Hey there, we are back with another live training. Welcome to my little corner of the internet where I get to share all of my thoughts about the rehab world. Thank you for watching wherever you are watching from. I'm happy you are here. Um, that you're interested in listening to what I have to say. Thank you if you are watching in the Clinical Connections Mentoring Facebook group. Welcome if you're watching on Instagram. Welcome if you're watching on YouTube. Thank you again for being here. My goal is always to share tips and advice to help you build a career that you love, a career that avoids burnout so that you can enjoy both your career and your life outside of work. So today's topic is all about patient-centered care. So I'm going to talk about what that means, which I'm assuming most people watching know what it means, but we're going to go a little bit deeper into what it means when it comes to working with your patients and how it can actually help make life at work a little bit easier for you. Okay. So for anybody new here, anybody new watching, I am Dr. Jody Miller. I'm a physical therapist and a mentor to PT students and new grads. I've worked in just about every setting that you can think of. I've worked in acute care, I've done oncology, I have done outpatient, I have done pediatrics, home health, um, travel physical therapy. Most of my career has been in skilled nursing facilities. I was a rehab director at a skilled nursing facility. I've done adjunct teaching, lab assisting at multiple DPT schools, all that fun stuff. And I even own my own cash based practice right now where I work mostly with gymnasts and cheerleaders. But I also um, am the owner of Clinical Connections Mentoring, which is where you are today. So, what I'd like you to do, if you're watching live, please type live in the comments wherever you're watching from. Tell me who you are, where you're watching from. Same thing if you're watching the replay. I just like to know who I'm talking to, who's watching. And again, thank you for being here. So let's start with the definition of patient-centered care. So it is healthcare that focuses on the patient's needs, the patient's goals, values, and their desired outcomes. It includes developing a partnership with the patient and all the healthcare providers. It focuses on the patient's priorities and educating the patient on all of the information so that they can make an informed decision. So patient-centered care literally places the patient or the person at the center of the care team. That care team includes all of the healthcare providers, the patient themselves, the patient's family, the patient's caregivers, and it's really anybody that the patient wants to include on their team. Okay. The patient gets to define who makes up their family and who they want to be a part of their team. When this happens, it allows for safe, culturally appropriate healthcare for that patient. Okay. So having cultural competence can allow for better, more patient centered care. This means understanding, excuse me, how the patient perceives their illness or impairments and that they understand how that should be treated. It's knowing the patient's social barriers like insurance, finances, just access to care, and understanding how all these things, these social barriers, can impact the patient. It uses the patient's values in making healthcare decisions, right? And it's addressing the patient's fears and concerns about the treatment plan. When this happens, you are going to have better health outcomes, better allocation of resources, and definitely better patient and family satisfaction. Okay, so ultimately, patient centered care means providing care that is centered around what the patient wants, what they believe, and what they feel is important. This includes the treatment plan that you develop, the interventions you're using during your treatment plans, the frequency and duration of your treatment, the goals that you're going to be working toward, family and patient education, and even discharge planning. Okay. Every single one of these decisions should be made based on what the patient wants. And this is where it can get really tricky, right? We know what's best for the patient, right? We know the safest discharge plan. We know what the best evidence is. And we know what's best for specific diagnoses based on the research. We know what has worked for people in the past based on our, other patients we've seen. We know what the CPGs say and what the research say, but that's really only part of the equation. Okay. The most important part is what the patient thinks is important, what the patient values, and what the patient wants. We have to start here. That we have to let this guide the next decisions. This has to guide the other stuff. It guides the later decisions that we're going to make. Okay. And this is why communication is so important. Okay. I know I talk about this a lot, but this is why I talk about communication so much, because it really is the key to successful patient outcomes. Okay. So when it comes to patient centered care, you have to talk to your patients. You have to give them an opportunity to talk, and you have to listen to them. You have to listen to what they're telling you. You have to ask open ended questions and then let them give you the information that you need. They'll tell you what's important to them, they'll tell you what they value, they'll tell you where their priorities lie. By letting the patient feel heard, by really listening to the patient when they're talking to you, this is step one of patient centered care. Okay. This means that during an evaluation, regardless of the setting that you're in, you're asking questions, letting the patient answer, and not interrupting them. Okay. Asking open ended questions and really listening to their answers before jumping to the next question is important. For inpatient settings, this means really digging deep and getting details about their home environment and their social support, figuring out who and what is important to that patient. Okay. Who can help them when they leave? Who do they want to help them when they leave? Where do they want to go when they leave? What are their goals with therapy? How active were they prior to being admitted? And what was important to that person before they came to the hospital or the skilled nursing facility, wherever you're working, right? For outpatient, okay, this means getting details about what they were doing before their injury or before their impairments were present, okay? What was their job? What were their hobbies? What did they do for fun? What did they really enjoy doing? What did they miss doing? What could they do before they came to you in outpatient? What could they do before that they can't do now? What is really important to them? Okay. For outpatient, this also means getting information about previous PT or OT experiences. Okay. Have they had therapy before? What did they like and what did they not like? What did they think worked for them and what did they think didn't work for them? How did they feel about those past experiences in therapy? What opinions do they have about therapy? Did they think it worked? Or did they have a really bad experience and they're not really sure? Okay. You got to find out this information in order to be patient centered. So, this also means that at the start of each session, you are taking time to talk to the patient. Okay. Well, it doesn't have to be long, 3 minutes, right? Just take some time to talk to the patient again. How did they feel after the last session? What did they like or not like about the last session? What have they done since the last session? Anything new, anything different, right? And how do they feel about their progress so far in their therapy with you, right? You got to understand where they're coming from. This is being patient centered. The answers to all of these questions are going to give you information about what is important to the patient and what they value. When you know this information, you can develop a plan of care and then build your treatment sessions based on what the patient believes will help them, what's important to them, and what their goals are, right? So, how do you do that? Right? We all kind of know to do that, but how do you do that? How can that information that they're giving you be helpful? If you listen closely to the patient, they will tell you. Sometimes you might have to read between the lines a little bit. Sometimes they'll just come right out and tell you flat out. An example I can give you is when a patient has been to therapy before, right? If you ask the right questions, they're going to tell you what they liked and what they didn't like. After that, then you create your plan and your treatment sessions around what they liked. If you go ahead and do things that they said that they didn't like, even though the research might support it, but you did the thing that they said they didn't like, the therapy is not going to work. They already believe that it didn't help before, so why is it going to help this time? Okay. This also does not help build trust or rapport between you and the patient. Okay. If they tell you that something they did in therapy previously hurt them or it made them feel worse, I recommend not doing that thing. Okay. Another example is when a patient is telling you what's important to them. Okay. So sometimes this can be a little bit harder to catch without flat out asking the patient, which you can do, right? Ask them what's important to them. Sometimes they won't tell it to you. Sometimes you gotta dig a little bit more. But sometimes if you really listen, you might catch some important information. I one time had a patient, she was telling me about actually two previous therapy experiences she had gone to. And she was telling me about what she was currently limited with. And she really quickly mentioned that she used to lift weights, but she wasn't able to do that anymore. And then she kind of kept going. It was almost like she mentioned it in passing and had already come to terms with the fact that she wasn't going to be able to do that anymore. But I heard it, I caught it, and I said, whoa, do you want to lift again? Because if you do, then that's what we're going to work toward. And her answer was yes. Nobody has asked me that before or said that I could do that. And ultimately, this is what me catching that and asking her if that was important to her, that's really what made her decide to come to me for PT. Okay. So you have to ask the right questions and give the patient time to answer. Ask your question, be quiet, listen to what they're saying. They will give you all the information that you need. So I've talked about what patient-centered care is, and I've talked about how to use it when working with your patients. But the struggle, especially for newer clinicians, is between what the patient wants and what we think is best for the patient. Okay? Because there are a lot of times where these two things do not line up, right? So, what happens when what the patient wants is not safe? What happens when we think that there are much better treatment ideas or treatment options? Or what happens when we know that the intervention that they want isn't really going to help? The simple answer is it's not about you. Patient centered care is about the patient and what they want. It's not about what you want for them or what you think is best for them. It's simply what the patient wants. So, what do you do here? Because this is a challenge, right? If these two things are not lining up, what do you do? First, you educate. So, step one is educate. The patient needs to be educated on all of the options that are available to them. They need to be able to make informed decisions, and they cannot do this unless they have all the information for all of their options. Okay, remember, education is a part of patient centered care. By educating them, you're not telling them what to do, you're not doing that. You are just giving them all the information so that they can make the decision that they feel is best for them. It's patient centered. The patient gets to make the decisions. Here's an example, and this is a very common example, and it is one that is very hard for students and new clinicians to swallow. And that example is discharge planning. Okay, so in all of the inpatient settings, one of our biggest roles as therapists is in discharge planning. Oftentimes, what we think is best for the patient is not what the patient wants, right? There are going to be 11 billion times where you think it is best for a patient to go to an inpatient rehab facility or a skilled nursing facility so that they can get more therapy. But the patient is going to want to go home. That is going to happen more times than you want, more times than you feel comfortable with. But I'm telling you now, it is going to happen. In these situations, all that you can do is explain to them why you think subacute rehab is beneficial for them and you make your recommendation, right? I think this is good for you because of X, Y, and Z. This is my recommendation for you. But ultimately, the patient gets to decide where they go. If they're adamant about going home, but it's not safe, you simply have to do what is best by educating them, right? You have to educate, do your best, right? Even if you know that's not safe, explain to them extensively why you think that's not safe and why you think these other options are better for them. Second, you collaborate with them and the entire patient healthcare, the entire team based on what the patient has decided the team is. So in that same example, the discharge planning, if that patient is still adamant about going home, but you think it's unsafe, then you have to work with the family and the support system to figure out how to make home as safe as possible, right? Consider all the options, educate the patient and the family on all of the options, all the things that need to be done to make home safe. Then they get to choose, right? Can those things be done? Is it safe? The patient gets to choose. Remember, patient-centered care includes education and collaboration. The entire healthcare team has to work together to figure out the best option for the patient. And remember, the team includes the patient and their family or their support system. Not about you. It's about what the patient wants. Okay, so what happens when a patient tells you they want a certain intervention, but you know the research does very little to support that intervention, right? You want to be evidence-based therapist. You want to do what the research says, but the patient's asking for something that you just know is not going to work. Talk about a real internal struggle, right? So again, in this situation, your job is to educate the patient. Tell them what you know, but I do caution you here, try not to be sciencey. Do not get too sciencey. Don't use all those big science words. Patients don't care about science. They just want to feel better. They want to regain their function. They don't care about the science. So explain it as simply as possible. But you also have to keep an open mind and stay open to what is important to the patient. Remember, it's not about you, it's about the patient. If they want a specific intervention, you have to stay open to trying it, even if you don't think it's going to help. Because 9 times out of 10, if a patient thinks something is going to help, it will. The mind is a very powerful thing. So if a patient thinks that joint mobs are going to help their pain, there's a strong possibility that it will. The best example I have of this, as a new grad, patient wanted ultrasound. I wasn't a fan of it. The research didn't support it, but I did it anyway. I did my 8 minutes of ultrasound. I think it was low back. We were done. She said, "Oh my gosh, I feel so much better. Thank you for doing that." She walked away. I realized I never even turned the thing on. Okay. The mind is powerful. The patient thinks it's going to work. It is going to. Okay. This is why I say, listen to what the patient wants. They are going to tell you what is going to work for them. Ultimately, this is going to make your job easier and your patients will get the outcomes you want. And I get it. You're probably thinking, oh God, Jody, this is totally against my values, doing things that aren't research supported. I get it. It's okay. In that situation, you can just do a combination of interventions, right? Remember, educate the patient on what you think will help. Give them all of their options. Let them choose, right? If you want them to be open to trying different options, you also have to be open to doing some of the things that they want. So you don't have to do, an hour of manual therapy if that's what they want. If you're not too keen on manual therapy, you don't think it's going to help them, you can do 5-10 minutes of it. Spend the rest of the time doing more evidence-based things. Okay? The patient always knows what is best for them. Sometimes they need a little bit of help to get there, but they always know. So to fully provide patient-centered care, give them the chance to tell you what's important. Listen to them, educate them on all of their options, and let them decide. Then you support them in their decision by collaborating with them and working with them, working together with them to develop the plan. It's not about you, it's about them. Okay. As rehab professionals, we put a lot of effort into providing individualized care and developing effective treatment plans. But to do this effectively, you have to have the patient's input. By listening to them, working with them, you will be able to create the most individualized and effective plan for each patient. I understand that for newer grads, newer clinicians, this can seem really daunting and difficult and probably goes against everything that you've been taught, but that's why I'm here, okay? Helping therapists figure out how to best communicate with patients is it's just one of the areas that I guide new grads and even seasoned clinicians to figure out in my complete clinician mentoring program. It's a 6-month program that offers support and guidance wherever you want it. You drive the bus. So, in addition to communication, the program also includes helping you figure out how to create effective treatment plans by taking all that information that the patient gives you, melding that with the best evidence, basically going deeper on what I talked about today. That's one another thing that I help a lot of my clients do. I also help them to manage imposter syndrome and perfectionism so that you can become a much more confident clinician. I help them set up careers so that you can avoid burnout, whatever that career path is, and that starts with choosing the right job. So I help a lot of my clients figure out what the best job for them is. And I also help with strengthening clinical reasoning skills so you can confidently work with your patients. And there's those are just a few of the things. There's so much more that I do within my 6-month mentoring program. If you're interested in learning more about that program, go ahead, type complete in the comments, and I will reach out with more information, or just feel free to send me a message, direct message, and we can chat there. There are no commitments. It is just me giving you information because you get to decide what is best for you, just like your patients. I hope today's live was helpful. I hope you learned something new today. Please go ahead and drop in the comments your aha moment or something that really stood out for you or something new that you learned today. I want to thank you again for watching, whether you're watching on Instagram, whether you're watching on YouTube, or in the Clinical Connections Mentoring Facebook group. If you have any questions about what I talked about today, please feel free to message me or just drop your questions in the comments. I will come back and answer them. I will see you next time.